Good evening. I'm Larry Parrish, the Executive Director for the SHINE CDC, where the SHINE stands for Sharing Hope in a Negative Experience. And man, oh man, oh man, do we have a great V Talk in store for you tonight. I want to now pause for a second and introduce our host for tonight, Dr. Jackie Nickerson. Dr. Jackie Nickerson, I want to turn it over to you because I know this is going to be one of the best V Talks we've ever had. So over to you.
Thank you, Deacon Larry. Yes, tonight we are going to talk about heart health, and we have our resident doctor, Dr. Sharon. We know Dr. Sharon, she brings it real to us every second Wednesday of the month. You know, Dr. Sharon is a speaker, an author, a health educator and physician, and a health strategist consultant. She serves as the executive director of the Co-Star Healthy Communities Foundation. She's an avid medical researcher with numerous publications and presentations. She's an expert advisor for both the government and private sector on awareness and media campaigns. She's also an expert on physician-patient pharmaceutical engagement with a keen knowledge of regulations, health literacy, and cultural competency. Dr. Sharon, we thank you for always coming to us and bringing us the health information that we need. And tonight, as I said, we're going to talk about heart health. Right?
Yes, it's February.
It is February, right? February is the love month. February is the heart. And we know heart disease is the #1 killer of Americans, right? Last Friday was Go Red for Women, was the campaign to promote heart health awareness for women. And hopefully they start taking ownership of their own health to get better, right? So we know that, approximately 50,000 African-American women, particularly it's hitting them a lot harder now. And they're dying from this yearly, but majority of the cases are preventable. Can you tell us some things that we can do to prevent heart disease?
Same thing that I would tell you as it relates, and let me just back up and say what heart disease is, because I've done national talks and it's like, well, I don't have heart disease. I just have a little high blood pressure and a little high cholesterol. Okay.
Right.
Heart is a pump. Your blood pressure comes from the heart. And so if you have high blood pressure, you are certainly at risk for more advanced heart disease. But again, that is a disease of the cardiovascular, big medical school word for the heart. High cholesterol is, again, puts you at increased risk for heart disease. So, and then a sidebar, diabetes puts you at increased risk for heart disease. So it's the same thing that we talk about a lot: exercise, and even more than exercise, diet, what you eat, low salt. I continue to say sodium or salt is poison, particularly to Black people. If a Caucasian person or white person takes a teaspoon of salt and a Black person takes a teaspoon of salt, our blood pressure goes out the roof. We are very salt sensitive. So low sodium diet, no household with anybody, Black, white, pink, green, blue, needs to have salt shakers on the table. But certainly Black households, get rid of the salt shaker, the Old Bay, the Lowry's. That's #1. #2 is exercise, low fat, and it's not a death sentence. Oh, I can't eat anything. No. More fresh fruits, more green vegetables, those things, and then get it moving. We've talked before about moving in the face of COVID, walking and doing what you can, even in the house. Those things help you get the muscle of the heart, because the heart is a muscle about this big, the size of a man's fist, in the middle of the chest.
Right. Thank you for breaking it down. So we need to know our numbers, right? We need to know our blood
numbers,
our cholesterol. So those are things that when they leave the doctor's office, or even if you go into Safeway drugstores, they have those. At least you can get blood pressure, right? But know those numbers and know your family history too. Right? So like you said, yes, we are as a community notorious for adding salt before we even taste the food. So that's yeah. So would you so I know you said low salt diet, but would you recommend not using salt at all?
At all, because you're going to get salt anyway. One of the highest salt content foods is, guess what? People think about fried chicken, all that other stuff. Bread. Bread is a high salt content food. Somebody say ouch out there in the chat. Somebody say ouch. You're gonna get all the salt. You're not gonna be low sodium that you just have no salt. So I wouldn't add salt. And add, when you cook, I love to cook, add fresh herbs and spices to give you the flavor. And I'll tell you, Dr. Jackie, once you get away from salt, in about 2 weeks, your palate will become so sensitive. You'll be like, oh, that's so salty. I can't believe I had that. And then one thing you said that I love is, yes, go to CVS, get your blood pressure taken, sit in the chair. But more importantly, we pay about $75, $65 in the DMV and all over the country to get our hair done, our nails done, all that. Spend about $50 at CVS, Walgreens, Walmart for a blood pressure cuff. Every house needs a blood pressure cuff in it. You can get the wrist or you can get the one on the arm that you can take your blood pressure at home. Invest in that, and a finger stick or a glucometer, even if you don't have diabetes.
Oh, that's great. Yeah, that's a great tip. Yeah, definitely have one. I know we have one in my house, but yeah, for sure. Again, you know your numbers. You know when you're not feeling well, you're like, let me go check my blood pressure. Maybe I did have too much salt today. So those are things. Yeah, that is awesome. All right. So yeah, so talking about the heart, we know we've been in the pandemic almost a year next month, right? So the symptoms start out, we knew it was a respiratory disorder, but now we are seeing there's some long-term effects that are affecting the heart. Can you tell us what we know about how COVID is affecting our heart?
Well, first of all, we don't know yet. So we don't know for long-term if it's a long-term effect or not. But what we do know is it's something called itis, I-T-I-S. If you ever see that, myocarditis, any of those is inflammation. What we know is the COVID virus does attack the heart in many cases, particularly the severe cases of people that have been in the hospital and are very sick. Or we've seen that also in athletes. We had some outbreaks with football players, basketball players that are young folk that were having some heart issues. And that was, again, inflammation of the lining of the heart. The heart is a muscle. It has a lining. And so you have inflammation there. We do know that. And, other things associated with the heart is fatigue. Sometimes, we call high blood pressure the silent killer because you don't really have symptoms, except for you can be really tired. And so that is the same as with COVID. We know that one of the long-term effects is not only inflammation of the heart, fatigue, inflammation of the joints are also effects, and palpitations. We will know more in about a year. And certainly the cardiologists are tracking, and there are several syndromes. If you have had COVID and it was serious, you do need to make sure you talk to your internist, your family physician, get what's called, big medical school word coming, echocardiogram. That's the same thing they do if you're a woman and you were pregnant and they put the jelly on your belly. It's an ultrasound of the heart to look at the squeeze and the effectiveness of the heart. Get an ultrasound and an EKG.
Okay, so yeah, so if you had COVID, you survived it. That's definitely something to put on.
Definitely.
Your doctors, I know a lot of people if they had COVID and they contact their doctor, because most of the time you didn't go in for any treatment unless you had some problems with your breathing. So are doctors, contacting their patients that had COVID like that, or is that on the patient to contact them? Okay. Thank you for the face.
I would contact my doctor.
Okay.
All my colleagues out there love y'all, but nobody's sitting around saying, oh, Jackie had COVID. Let me just call her and tell her all this stuff. You take ownership. Y'all know I keep it real. Yeah. You take ownership. As I say all the time, if there was a dress sale at Saks or Neiman's or at Walmart, and you got $50 off the dress and you would hunt it down. I want you to hunt it down for your health.
Very true. Very true. Okay. So yeah, So yeah, so now with that being another thing, because before all we heard about the shortness of breath, we heard about the fever, we heard about the loss of taste and smell, but now heart issues, right?
And palpitations.
And the palpitations.
Little palpitations.
Right. So how do we distinguish between, because I know you said fatigue was a big thing that they've seen in athletes, and then they found out the inflammation around their heart, but how do we know it's just not, we're doing a lot, right? That is not normal fatigue and that it's something more serious?
It really is. So it's one thing to be tired because you slept for 4 hours and ran a marathon and ran around with them nappy-headed bad kids, right? That's one thing. Another thing is that I am tired, but I slept 8 hours. A week later, I'm just so tired. I'm short of breath. You should always get that checked out. It could be a whole host of things, but certainly it could be a sign that you have had. Remember, COVID is a virus that invades your body. And so it could be your body kicking back saying, hey, watch out, something's wrong. Fever, those things we know, like you said, taste and smell, but just feeling tired. And it's important to note, what we are seeing long-term is people got COVID 8 months ago, they still are very tired, or they're having problems with muscles, and they're having problems kind of navigating life. There is a small subset of patients that have really been hit hard and have some other inflammation and those things. So I tell you, one of my best friends was recently diagnosed with COVID, had COVID pneumonia and blood clots. And one of the things, she's trying to go back to work, and I hope she watching in 2 weeks. No, you're not going to be able to do that because you're going to be too tired.
Okay. So now are some of these new symptoms that with the blood clots and the heart, is that coming up because of the new strain, or has that been all along?
Excellent question. Actually, we have always known that with COVID, that number one, that you have the respiratory issues, you can have COVID pneumonia, but that you are in another, I'll just prove that I went to med school, hypercoagulable state, which means that you are prone to have blood clots just because of the virus invasion. And then to get clots in the lungs, they usually are coming from the calf, and we're sitting around more. We are, and if you're sick with COVID, you may be laying in bed more, and then you get a blood clot and it goes to the lung. So you need to really make sure that we don't take it lightly. And Dr. Jackie, for real, we have been in this almost a year, and now it's almost getting to the point of normalcy. No, people are still busting at the seams in the ICU. People are still dying every day. And unfortunately, those people, a lot of them look like you and me.
Yeah, that is so true. Yeah, that's still the scary part. We know the vaccine's there. So you mentioned I saw you on one of your lives last week. You said you won the lottery. You won the lottery. Explain to everybody what you meant by what you won the lottery.
I won the lottery. Don't nobody ask me for no money. I won. And so do y'all follow me on Facebook or whatever. I won the lottery because I got my second vaccine. And I had the Moderna vaccine. People are asking me now because there will be another vaccine, more than likely Johnson & Johnson at the end of the month is going to get approved here, and another that's a one-shot dose. So we know that there's a Pfizer vaccine, the Moderna vaccine. You don't really get to go say, I want this one or that one. Okay?
Right.
Go and thank God and all the angels that you were able to get a vaccine.
Exactly.
With these shortages. But that, so I got my second vaccine. I was very public about my first, and the second vaccine I got last week, which means after the first vaccine, you're about 67% covered or immune. After the second one, in 2 to 2.5 weeks, I'll be 95 to 97%. That even if I get COVID, that I will not have the serious side effects, statistically speaking. And so I had very little response. Some people are talking about fever, chills, feeling bad, all of that after the second. Me personally, I had a little fatigue on day 2 and a little headache, but that was it. But there are certainly risks. associated. And in some ways, it's good because if you have a reaction, that means your immune system is revved up and ready to fight COVID.
Right, right. Yeah, that's true. Yeah, I've been hearing different stories too. Some people, the second shot, nothing, and then like my mom got her second shot 2 days ago, and she's like, "Hey, that was fine tonight." She went to work by 9:30. She's like, "Ooh, I don't feel so good." So went home, took her Tylenol, and now today she was a much better day. So I mean, it does vary from person to person. Like you said, the key is making sure you get it. So I know you mentioned the shortage of the vaccines, right?
Yes.
Right now, I know a lot of people getting turned away who had appointments for the first one because they're trying to do the second. So in the event that perhaps maybe someone doesn't get their second shot in that window that they're recommending by, Pfizer and Moderna, what they don't have to start the process again, do they?
No, not if you're within, say, 3 weeks, 4 weeks. Certainly, you can't wait 6 months. All right, you have to start over. And there are enough vaccines that typically are being held back in most areas. Let's say, because you can't be 100%, that you will be able to get your second. You should just contact where you got your first one at. And say, this is my second vaccine. And thank the Lord that the distribution process has gotten much better and is getting much better every single day. So go ahead and get the first shot or the second shot. If you wait and you're called up, say in March, you may now be offered, if it gets approved, and it looks like it will, the Johnson & Johnson one shot. And then we're going to have another one out. And so it really is important. And particularly, I'm spending probably 75% of my time in public talks talking to people that look like me, saying, y'all, please get vaccines. Stop this foolishness. Don't look on the internet at crazy stuff. Look at reputable websites and get the information. My mother, 80 years old, got her vaccine last week, her second one, and she's like, I'm fine. Wow, I'm good. I still got to wear my mask though. Yes, mommy, you still got to wear your mask.
Yeah. Oh, so you just brought the mask, right? Brooks just had Dr. Fauci the other day on a live, and he mentioned, I saw you had mentioned as well on your site, just with the double mask. Can you explain that to us?
Well, just think about it. Sometimes doubling up helps. So you need a good seal. And y'all done seen some foolishness out there with these masks under your nose. What? Under the nose, up above the mouth, ass, or out, or you just have it under here. So you don't have a good seal, or it's too big and you're always pulling it up. If you have a surgical mask on and then your little cute mask, you have a tighter seal. And that means that you are both protecting the public as well as being protected from potentially being exposed from the virus. It's just having a double layer. We know that if we're very, very careful and we're cooking something and it's very hot, we often will put on 2 gloves. It's the same exact thing.
Okay, yeah, because that was a question, and people were like, "Well, why are they saying 2 masks now? Why haven't been wearing 2 masks? Is it like, they're like, is there multiple strains? Are we gonna get it faster?" So that people were getting concerned.
Well, we do have multiple strains.
Yeah, multiple strains, out there.
But we've always, sometimes things get sensationalized. There are multiple strands of the flu. A virus is smart, right?
Right.
And so a virus will change itself and say, y'all think y'all got me, I'm going to come in another door. But it is important that both the Brazilian, the African, and certainly the British strand is more potent, for lack of a better word. And so you just have to keep wearing your mask, stay home if you can, and then wash your hands, social distancing, and all of that.
Okay, so keeping up the same, right? And even though it's become a normalcy with the pandemic and all of this, still nothing has changed, right? Because it's not gone.
Get vaccinated because y'all tired of being at home, go get vaccinated. The more people we vaccinate, the more people that have immunity, then we'll be able to ease up some. But until we have massive vaccinations in the United States, and a little tip, I do not believe, and this is Dr. Sharon, that we are going to have as much travel freeness as we have before without having that little vaccine card. And I'm with it. I'm with
Yeah.
it.
Yeah. I think that's where it's going to go to. Who sitting on the fence? You just be sitting on the fence in the U.S. You won't be able to travel, or whatever country you're in. I believe too. Yeah. Well, thank you, Dr. Sharon. I think we have some questions and things. Deacon,
Sure.
you coming back in?
I am back. So we do have some questions coming in, and we have our first question from Kevin. And Kevin said, "Can you explain the difference between the three vaccines, the Pfizer, the Moderna, the Johnson and Johnson? Can you explain the difference between them?"
Think about Pfizer and Moderna has essentially the same with some changes, and that's and they're called mRNA vaccines. So they take a piece, and you cannot get the virus, somebody type that in the chat, from the vaccine. Ain't nobody giving you the virus in the vaccine. That's one of the biggest myths ever. You cannot. They take a core piece, a genetic piece called messenger RNA for the Moderna and the Pfizer. And then the other vaccines, and there are more mRNA vaccines coming, but the Johnson and Johnson is a different method of action, similar to the flu and other vaccines that we've had before, but it is not approved yet. That's not why I'm not spending a lot of time on it. That and AstraZeneca's vaccine is being used in Europe, but certainly some trials have been stopped in Africa. And guess what? People ask me all the time, what are the long-term side effects? You know what the answer is? We don't know, because it hasn't been long-term yet. But we do know there were enough in the clinical trials that if it's COVID, severe COVID and death, or the vaccine that has been tested in hundreds of thousands, now millions, yeah, I'm gonna take my chances with the vaccine.
Okay, and I know we're now opening up the questions for Facebook as well, but we have another question came in from Erica, and it says, on the side effects, are there difference between the three once Johnson and Johnson is joining Moderna and Pfizer?
It essentially is not, because all of these are vaccines which will help stave off a virus. So basically, you have fever all the time when you introduce something new into your body. Fever is a natural response to, hey, something is going on. Okay, whether that's a cold or anything, that's always a response. Even with cancer, you get fevers. With the vaccines, fever is one, fatigue, of course, simple. And I didn't say this, Dr. Jackie, simple. Now I'm gonna tell you what did happen. My arm was sore from that needle going in my arm. I think everybody's uniform. The big needle in the arm, yeah, that's a little
mine was the first one, yeah.
that's a little problem. And it was a little worse for me with the second one. But the basic side effects or things that could potentially happen. You could be like everybody, many people that say, I don't have any side effects, but you really could have those basics: fever, fatigue, headache, some chills. Those are the basics.
Awesome. Well, while we're waiting for some more questions to come in, Dr. Sharon, on Facebook, I have one. How really does stress affect the heart? I heard a lot of people, even my doctor tell me, he said, you've got to lower your stress level. You got to exercise more. What does that really do to the heart, though?
Excellent. So, and I meant to add this earlier. These are numbers that you must know outside of COVID. Less than, somebody put it in the chat, less than 120/80 should be your blood pressure. I don't care if you've had high blood pressure for 10 years and on 50 drugs. If your doctor is telling you, oh, 140/90 is fine, whatever. No. You want to be less than 120/80. That is the goal. And so what happens is the heart is a pump. When you squeeze, that is the 120. When you relax, that is the 80. Think about it. If your heart is relaxed and the pressure is still high, that's a problem. And so with stress, what happens is the heart is not as contractual and pliable, and stress, you're always in fight or flight, your blood pressure goes up. You know, that's how people are able to move cars. You know, you get into an accident and you're able to lift a car off subhuman strength. That is, you're in fight or flight and everything kicks in to give you that strength to do that. You don't want to be like that all the time. So with stress and certainly being a Black man, Black woman in America, we now are looking at race as an independent factor for heart disease and racism. And so the stress of life, the stress of even COVID and the pandemic causes some heart issues. And the other part, I said less than 120/80, that's blood pressure. But also, I have to make sure everybody knows, since we're talking about heart, your total cholesterol. And if you think about this, if you have a water hose outside and it gets crud in the middle, water doesn't come through as well, right? When water stops coming through, that is called a heart attack. Okay, blood doesn't go through. So you want your total cholesterol to be less than 175 is what we're saying. Much of the literature will say less than 200, but if you aim for 175, you give yourself a cushion. Your bad cholesterol, less than 80, your good cholesterol, greater than 60. That's some little knowledge right there.
Awesome.
Yeah.
Yeah, you dropping all the nuggets on us tonight. Well,
Yeah,
this one is from Minister Billy. Yes. I got my cup too for my blood pressure because it runs in my family. The blood stops here. Minister Billy, oh, that's a good one. She says, what about those who have compromised immune system? Is the vaccine still safe?
Excellent question. Actually, if you have compromised immune system, you need to run to your doctor and make sure that you're okay to get the vaccine, because you actually would be a priority. So persons with HIV, AIDS, those things, again, you are a priority, because remember, if you have a compromised immune system and you get COVID on top of that, we now have an issue. If you have an allergic reaction, this key point, where you have taken something and you stop breathing, or you have major hives and that stuff, you need to talk to a healthcare professional. And certainly if you're getting the vaccine, you tell them, I have had what's called an allergic or anaphylactoid reaction in the past. And that is a red flag to say, okay, let's see if we need to, if you're going to meet the criteria, depending on what caused it. And certainly you would be watched more. So great question.
Awesome. Okay, now
compromised patients talk to your physicians. Mm-hmm.
So we had someone 67 years old get the vaccine last week, and we had someone 22 years old get the vaccine last week. The 67-year-old had no complication. The 22-year-old did. Can you explain why? Everybody said that's like a mystery.
Two different people, two bodies. That's it.
Two different people.
Two different people. Your body reacted. And in some cases, if I put my science hat on, that 22-year-old probably has a better immune system. And so it really revved up and said, hey, something's here, so let's get this immunity going. But just two different bodies. There's no rhyme or reason. Your bodies react differently.
Right. And that's one thing that it gets sensationalized, because you don't know that person's their medical history. Or they had a reaction, they died, but you don't know any underlying facts. So people go off of that, and you can't hang your hat on that information. Yeah.
Wonderful. And I see we've had the wonderful Dr. Jazz here joining us. I'm sure she has a question.
Hey, Dr. Sharon, I love you. I just love your information and your insight. I know they're opening the schools back. What is it with vaccine with kids? Any progress in that? And are kids getting COVID?
Actually, the first initial deaths with children have been Black children. So yes, children do get COVID, but their immune system, for lack of a better word, is a bit better than ours. So they are more prone to get COVID, not have any symptoms. And then there is a subset that will. So certainly children with asthma, breathing conditions, cancers, those things are at higher risk, but they also will transmit the virus to someone else. And that's why it's a big push on teachers being vaccinated. If you bring, 10 kids, 20 kids in, those kids could be carrying COVID and then the teachers could be infected. But they are at much less risk. And you bring up a great point, Dr. Jazz. The initial clinical trials did not have enough children in them to make a definitive statement to say, okay, this is safe. We now have more and more children being enrolled. And I think, especially by some of my meetings and some of the data that I know, in several months, we will have tens of thousands of children that now have been in a clinical trial, and we will see which vaccine does best for them.
Thanks.
Dr. Sharon, we had another question from Renee. She wants to know about the high risk for sarcoidosis in the lungs and heart.
Okay, so sarcoidosis, let me break that down to you. Basically, you stop as sister to lupus, is a inflammatory condition. Some people have skin sarcoidosis, some people have lung compromise. Certainly, if you have sarcoidosis and you get COVID-19 and it affects your lungs, you're already starting behind the gate because you already have something that could be potentially life-threatening to the lungs, and you get COVID on top. This is a discussion with your rheumatologist, okay, who handles your sarcoidosis on whether you should have the vaccine or not. Most of the time, you're actually going to be pushed up the list to get the vaccine more because you're such at a high risk, because you do not want a sarcoidosis reaction and COVID pneumonia at the same time. That's not good.
And you mentioned the pneumonia. I was saying my husband lost his stepfather a couple weeks ago to COVID, and pneumonia was the main thing they were trying to treat that we're having difficulties with. So can you explain like what is the battle with that, the pneumonia, and then trying to treat for everything else?
So you get COVID pneumonia, which basically you can get bacterial pneumonia, you can get with AIDS, you get PCP pneumonia and all that. It is the virus goes into the lung, and then the lung forms a little ball or something that we see on x-ray that says you have, you can also have just fluid in the lung, which you're going to have with pneumonia, but it's an infection that has affected the lung, okay? Just like you have, and this is very simplistic, but if you had a big pimple or a boil on your skin, yeah, think about that in the lung. And that's very simplistic. It's not, so don't nobody email me and say, oh, you done made it too simple. You understand what I'm saying. So again, it is that you have bacteria or a virus in the lung and the body starts to try to fight it. But think about it, the lung is sacs. Okay, the lung is simply sacs. It's just air sacs or whatever, and anything in it is going to cause it to say, hey, I can't move as well. I can't move air as well. And this is one of the reasons why early on the death rates from COVID, and we still have death rates that are high, but we can treat it better because we now know that patient with COVID pneumonia needs to be put on their stomach, on the ventilator, because we know we got to keep the fluid out and we've got to treat it in that way. So even as we are moving through the pandemic, we all focus on the vaccine. We focus on remdesivir, the miracle drug, the steroids and all of that. But also people in the health professions are knowing how to run a ventilator with COVID, because this is new. Know which things work, which don't. And so we are seeing some progress in that area. So pneumonia is an infection of the lung. That's the easiest way to think about it.
Hey, Suzette wants to know what are some foods that helps with you should stay away from when you have inflammation.
So number one, fried foods, whatever, always. Fried foods are key. But I want to turn this, things that you should eat if you have inflammation. And so foods with number one, turmeric, You should cook with turmeric and all of that. If you have joint inflammation, arthritis, any of that stuff, turmeric is a very good natural product. That's also why if you see in Indian foods, you'll see some turmeric, cayenne peppers, those things. When you talk about foods that you should eat, anything that is an antioxidant, blueberries, blackberries, any of those berries and fruits are anti-inflammatory agents. But again, turmeric would be something. And then I would say, if you have particularly joint pain and inflammation, glucosamine chondroitin, which is a natural supplement that will help with that. Y'all making me think tonight.
Yeah, look, we got to do that when we have you. Only get you once a month. We get you once a month.
Love it.
All that question.
Let me make sure I get it right. Is my family really safe in the nursing homes?
It is, number one, better now. It will be much better in about 90 days. So initially, no, because that was COVID breeding ground, walking through the halls, okay? But if your family member has, is paralyzed, if you know honestly, and I do a lot of talks on caregiving and all that, if you know honestly that you can't take care of mama can't go to the bathroom, you can't do all that stuff, she needs 24-hour care, you can't do 24-hour care because you got to work or you don't have the support, then it is risk versus benefit. But I tell you, I do a whole talk on how to deal with the nursing home. Show up, even on the phone, show up, be like, yo, what's up? How's mama? Whatever. The squeaky wheel gets the oil. When my grandfather was in the nursing home, we would just stop by all the time. They always knew Allison would be coming by. He was perfectly fine because people knew, well, that I would raise the roof, and so would my family. But you have to make sure that you stay on it and that you have care plans, you have meetings and all of that to see. And again, you go in the nursing home, not now because you can't with COVID, but you ask the nurse, do they have bed sores? Do they have this? What's the temperature? And call different times of the day or night. You have to really balance that and pray about it, because you could bring someone home from the nursing home and they basically have a bad outcome, not because you intended to, but because you just can't take care of them 24/7. But it's risky.
That's really good. Thanks for sharing. So we have one from JP. He said, can you repeat those numbers? He said, because you said know your numbers, but he asked, could you repeat what numbers again?
Sure. And can somebody put this in the chat? Blood pressure. And I want you to make sure you put real big, less than 120/80. Top number 120, bottom number 80. Less than that. That's the goal. Total cholesterol. If you look it up in the book, it may say less than 200. This is what Dr. Sharon says, and most people are going to push for it. Less than 175. Okay? You want less than 175 for your total. Your bad cholesterol, which is LDL. L, you want to keep low. You want that less than 75. We have to have cholesterol. Our skin is made of cholesterol. Our organs are made of cholesterol. So there is a good cholesterol, which is HDL. HDL, you want to be high because that protects the heart. You want that, you want to push that greater than 80. How do you get a good cholesterol? Exercise and stop eating Big Macs and fried chicken.
The elephant in the room, I know Dr. Jackie's talking about COVID and Larry and blood pressure. Well, it's Love Month. I want you to give some tips, honey. Come on now to these Valentine weekend. Dr. Jackie's married and Johnny and Chastity, and help them out. Can you help them out? Help the married folks out.
You know, I love to talk about.
That's what I'm talking about. I don't know why they shine away. That's the elephant in the room.
I believe in a little sexual healing. I believe in it. So number one, Do something special, set the mood. Number one, for men, I'm gonna say this for men first. We all talking about what women gotta do. Take a bath, wash everything real good, real good. Real good. All right, you upset because woman won't go some places and put their face someplace. Wash your behind. Number two, same thing with women. But number two, probably, I know I'm crazy, Deacon Larry. I know, but Dr. Jazz know I'm crazy. So number two, make a time for you. If you're a couple, make time for you, even in COVID. Them kids gonna be all right downstairs. Do some candles, all that stuff. Now, don't plan no 3-hour big romantic stuff and you know you got an hour to hit it and quit it. So have a little meal. You can have a meal bought in, whatever. Put on some nice little lingerie, a little cologne, do something, and then work it out because that's a good cardiac workout, right? But also women, as we get older, vaginal dryness is an issue. I talked to women before, go ahead and get some lube, Astroglide, Uberglide, whatever you need will help you out, all right? And then for men, you know, y'all ain't 20 no more. Y'all ain't 20 no more. Do not go to 7-Eleven and get none of that stuff that say you're gonna be, 20 again, because you will have a heart attack and y'all be in the emergency room talking about, and you thought you could get Mega Man, whatever. But it's not just about the physical act, but that's important. It's not just about the physical act, and to make it so that you're not tired the night before. If you're gonna celebrate Valentine's Day on the 14th, that you're not so tired. That's one of the big things, is that you're tired. So, but make it special, and especially with COVID, you can't do all those little things that you used to do and go out and all that, and I'm gonna say that again, stay home. But have food bought in and all that, and just do, your spouse, and then do something physical. You may not have to have sex or intercourse or anything like that, but doggone kiss them. I mean, do something, rub the head.
We got you.
I'm just Dr. Sharon, let's keep it real, but that too.
Real all the time.
And
we love
it. That's right. And that is intimacy. And also just talk. The other part, just talk. And I do a real talk for women, drop it like it's hot and keep your man, because sometimes Christian women forget the basics. The Bible says, and I shouldn't say this with the Reverend Doctor, she's the biblical scholar, but the woman can be the door. Two things are open. Y'all think all spiritual, two things open. You minister to your man and tell him the Lord told me to minister to you, whatever. I bet you bring him to Christ. I'm just saying.
Any advice for the single women?
Do you. That's why do you. Ain't nothing wrong with it. Do you. Love on yourself, buy yourself some roses, some flowers, some candy, whatever you want. But also, you can't actually be in a good relationship with anybody else until you love yourself. And don't sit around and be like, oh, I don't have a man, I don't have a woman, I don't have a partner, I don't have I'm so, okay. You could think about the worst person you ever dated. They could be with you right now. So you may need to shout hallelujah and have yourself a wonderful time by yourself saying, I let Bubba go and I don't have that headache. And just know that take time for yourself, girlfriends, Valentine's Day, those things, love yourself and love on your friends. It's not just about eros love, it's also appreciating somebody else.
Absolutely. Hey, thank you so very much. And that's why this weekend we're planning for those of you who booed up, we got an event for you. And for those of us who are flying solo, we got an event for you. So get in where you fit in, but good God, get on in. I love Dr. Sharon. If you love Dr. Sharon, put a heart over your head. Put it in the chat. Thanks everybody for your feedback, Dr. Jackie and Deacon Larry. I know, Larry, you would turn in 50 Shades of Gray.
Good movie.
Yes, ma'am. But I love how Dr. Sharon, you just keep everything real. because we live in a real world.
I'm
So I
glad
love
y'all
that.
let me, because some people be like, "Oh, hold back." So, thank you. I love coming here. I love my Wednesdays.
Well, we thank you so much, Dr. Sharon, for definitely giving us information on heart health, how the things that we should avoid. Get rid of your salt shakers, everybody.
And
then
obey, and Lowry.
right. Oh, and obey. And that's gonna be hard in Maryland with the crabs now. I'm just telling you.
Obey makes a no salt. Obey
Okay.
makes
Oh,
a no salt. Obey, yes.
Oh, really? Oh, okay. All right. But yeah, we thank you so much again, giving us some pointers, all of your wisdom and knowledge about the vaccine. Definitely. And then who knew? We didn't know you were a love guru. We thank you for that information.
Actually, I'm on WHUR several times a year has a love, but I don't know where that came from. I wrote a book. All I ever did was love a man, and then that took me off. I do talk about relationships.
Well, thank you so much. Can you tell us your social media so if people already are not following you, we can.
Y'all follow me on Dr. Sharon Allison-Ottey on Facebook. Do look at my vaccine. I won the lottery, where I keep it real on that one. Yeah. I always keep it real. And then Instagram is Dr. Sharon AO. I think that's Twitter. But Facebook will tell you all my handles. And then I am drsharononline.com. And then, it's actually Dr. Sharon Allison-Ottey-online.com or drsharononline.com. And all of my social media hashtag, all that stuff is there. But Instagram, Facebook, Twitter, and then Beautiful Woman Inside and Out, which is one of my companies. Please join the thousands and thousands of women that are on that. We're always trying to empower.
Thank you so much. Thank you so much. Deacon Larry, do you have anything to close us out?
Yeah, to our pastor, because she's going to close us out. I just want to let everybody know, you heard our pastor talk about all the wonderful things that we're doing for the singles, for married couples, for the couples. If you're engaged, go to victorygracecenter.org because you need to sign up. And guess what? It's free. We're all on Zoom. So you can save some money and still have a good time with your boo. And then she got something for you. If you don't have no boo, she got something for you there too. So we got you covered. Go to www.victorygracecenter.org to sign up. And now over to the wonderful Dr. Jazz.
Oh, thanks again, Dr. Sharon, Dr. Jackie, and thanks, Larry. Hey, everybody, thanks for joining us. This is going to be premiere on YouTube, so it's coming around again. So make sure you share, subscribe to victorygracecenter.org. And every Wednesday, we're trying to do V-Talk to empower you and equip you so you can walk in victory in your health. All right, God bless y'all. Have a good night.